With an urgent mission to address the alarming rise in drug overdose deaths, the University of Maryland School of Medicine has launched the Kahlert Institute for Addiction Medicine.
There's more than 100,000 deaths per year of overdose last year. And Maryland is one of the states with the highest rates of overdoses.
The Collaborative Institute will bring together neuroscientists, clinical researchers, and substance use specialists under one umbrella to develop new strategies for research and treatment.
So the vision of the center is really to reduce death, illness, and morbidity, and the effects of addiction in the state of Maryland, especially in disproportionately affected communities.
School of Medicine faculty will serve as an integral part of the institute, studying the brain mechanisms involved in substance use disorder and the lifelong consequences of addiction.
We have people dying at an unbelievably high rate right now, so we need to do two things. We need to get treatment out to them as quickly as we can, but we also have to develop new, better evidence-based treatments based on the mechanisms of science.
The Institute is funded by a $10 million gift from the Maryland-based Kahlert Foundation, with an additional $10 million from the University of Maryland, Baltimore.
Unfortunately, I would say most everyone in this room has probably been touched by this, either through a family member or a friend or a coworker.
So this allows us to create that center and to shine a very bright light on all aspects of addiction.
Lieutenant Governor Aruna Miller, who lost her brother-in-law to opioid addiction, conveyed state support.
Substance use disorder is something that touches all of us. Either we have struggled with it ourselves, or we know a loved one who suffers from addiction, or we know someone who has lost his or her life to this disease.
Education will also serve as a foundational pillar of the Kahlert Institute, with training provided on addiction treatment. Another major goal of the Kahlert Institute is to improve the continuum of care for people with addiction use disorder. For the University of Maryland School of Medicine, I'm Larry Roberts.